Hi guys, hope you're all well. This is Ulas. Today we'll study the cubital fossa. Okay guys, let's get started. Guys, what is cubital fossa? Cubital fossa is a triangular depression in the elbow region. Cubitus is basically the elbow. It's a Latin word for elbow, and fossa is a depression. So a triangular hollow or triangular depression in the elbow region is the cubital fossa. Now we'll study that under the headings of boundaries and contents and an interesting clinical importance too. Guys, we just discussed that the cubital fossa was a triangular depression, isn't it? Now, if it is a triangular depression, a triangle has three sides, isn't it? The three sides, one side we take it as base, other two sides are taken as medial and lateral borders, basically medial and lateral boundaries. We'll study that now. See here guys, this is the medial aspect, this is the lateral aspect. What is forming the medial boundary? Medial boundary is formed by this muscle, the pronator teres muscle. What is its action? Its action is pronation. See, it's coming from the medial aspect of the humerus and going to the radius. So guys, see here, in case of cubital fossa, that's a thick muscle. It has some thickness. So cubital fossa is a triangle. You can't take a range for it. So we'll take the lateral border of pronator teres, lateral border of pronator teres as its medial boundary. Now, see here guys, the lateral boundary is formed by one of the beautiful muscles called brachioradialis. It's coming from the brachium. What aspect of the brachium? Basically the distal distal humerus and the lateral aspect of it. Like there's a ridge for that. That comes from there and gets inserted into the proximal part of radius. It's coming from the brachium going to the radius. Where in the radius? Near the styloid process. So that is known as the brachioradialis muscle. Okay. It is also related to the cephalic vein. Cephalic vein goes between the brachioradialis and the superficial forearm muscles. Okay, so guys, see here again we'll be taking, it's not a range for a triangle now, so we'll be taking one line. Which is that line? That is the medial border of brachioradialis. Medial border of brachioradialis, lateral border of pronator teres. They form the two sides of a triangle. Now what is forming the base? A triangle must have a base, isn't it? The base is formed by the imaginary line joining the two epicondyles in front of elbow. See here guys, this line. It's passing through the two epicondyles and it is in front of elbow. Cubital fossa is also in front of elbow, na? So it's said to be in front of elbow. Now see here guys, you can see this space here now, like this triangle you can see here, isn't it? This is basically the two-dimensional image of a cubital fossa. But just now we discussed it's a triangular depression. It has a three-dimensional aspect. So if it has a three-dimensional aspect, it must have a roof and a floor, isn't it? Now we'll study the roof. Guys, in any part of the body, usually if you go from the skin, you will find apart from few limited places, if you cut the skin, you will find the superficial fascia where you will have the superficial vessel, superficial nerve and the fat. If you cut that, you will find the deep fascia, which will usually be present in most regions. If you cut the deep fascia, you will usually find the muscles and tendons. That is what happening here too. See here guys, you are cutting the skin, you will find superficial fascia. Superficial fascia has three important veins and two important nerves. Not important, they accompany basically. Now then there will be deep fascia and bicipital aponeurosis. We'll just study that here now. See here guys, this till now what we studied was, this is the brachioradialis muscle here. And this is the pronator teres. You can't palpate it. It's present there when we dissect it. It's a little deeper. So, and this is the imaginary line. Now, this was the cubital fossa, isn't it? In this, are you seeing my muscles here? No, you're seeing my skin basically, isn't it? So, we are cutting the skin like this. You will find the superficial fascia where there is fat. Okay. In this superficial fascia, there is something important which is happening. See here guys. There is one cephalic vein coming like this. It goes in the lateral aspect. Then there is basilic vein. My basilic vein is a little in the posterior aspect, but usually normally it will be present like this. And then there will be median cubital vein. Why is it median? Because it's in the midline of the arm. Then why is it cubital? Because it's in the cubital fossa. Why is it a vein? Because it is carrying blood towards the heart. So what is the importance of this? We'll study that soon. Okay, now this was the superficial veins. This is the cephalic vein, and this is the basilic vein, and this is the median cubital vein, isn't it? Now see, there are two important nerves taking part. See guys, this is the lateral aspect of my forearm, this is the medial aspect, isn't it? So this will be the medial cutaneous nerve of forearm, and this will be the lateral cutaneous nerve of forearm. They are accompanying their respective veins basically. So that was what we discussed here, guys. A medial cutaneous nerve of forearm accompanying the basilac, and the lateral cutaneous nerve accompanying the cephalic vein. Now then we have the deep fascia. Deep fascia, what will be there? Nothing much. There will be it will be separating the compartments and giving a proper shape, a proper compartment for the muscles to function basically. Now then we have the bicipital aponeurosis. What is bicipital aponeurosis? We just studied now, guys, a few classes ago. There is biceps muscle like this. It is coming two bellies. Then after coming here, it will be it will turn like it will go and insert into the radial sternum. This is basically tendon of biceps, and it will also give a bicipital aponeurosis like this. So bicipital aponeurosis is also forming the roof. It is covering the cubital fossa now, so it will also form the roof for the cubital fossa. See here? That was basically the roof. Now we'll go for the floor of cubital fossa. What is floor basically, guys? See, I have cut my skin, I have seen the cubital fossa and its contents, I have pulled out contents. What I am seeing below it is basically the floor of the cubital fossa. It is formed by two beautiful muscles, the brachialis and the supinator. See here, guys, brachialis muscle, we studied that recently now. That brachialis muscle is coming from the arm and going to the ulna like this. It is a big muscle, a big muscle. It will come like this, and it will be inserted into the ulna bone. This one basically. And there is one supinator muscle. It is a beautiful muscle. It's coming from the posterior, like there is a supinator ridge on the lateral aspect of humerus and the posterior aspect of ulna. So it will come like this and get inserted into radius. So if it contracts, see here, guys, it is coming like this and getting inserted into the radius. So if it contracts, it will cause supination. We'll study that in detail. So that supinator muscle will also be there. So supinator muscle and brachialis are forming the floor of the cubital fossa, isn't it? Those both for the floor. Now we'll go for the contents of cubital fossa. See here, guys, a very beautiful, like you can remember it very easily. If you get it in anatomy exam as a discussion topics in dissection, it will be really wonderful. It will be very easy, very limited contents, and you can see it very clearly too. Now see here, guys, what happens is in contents, you can remember this mnemonic as MBBS, from medial to lateral. MBBS, you usually know, it's a medical course for Indian students and most other countries too. So this MBBS is happening. What is MBBS? See here, guys. See the MBBS, M is the median nerve. Median nerve, we studied that now. It is coming from the brachial plexus. So median nerve is going in the cubital fossa, because cubital fossa is also in the middle part of the elbow. So it is coming from the arm going into the forearm through cubital fossa. So this was the median nerve. Median nerve. Then we have the B, which is that brachial artery. Brachial artery is coming like this, going till the neck of radius, where it is dividing into radial and ulnar arteries. Okay, so this is the brachial artery. Now what we have now, we have the tendon of biceps. We just discussed that now, guys. The biceps muscle is also giving a like it is coming to the it is coming to the neck of radius like this. The tendon is coming and giving a bicipital aponeurosis like this, isn't it? So it is coming to the neck of radius. We'll take that as a reference. And after that, what is S? S is called the superficial branch of radial nerve. Basically, radial nerve is also coming here, isn't it? Now, if that radial nerve is coming, guys, just see here. That radial nerve is coming here and giving a superficial branch here, and it is also giving a interosseous nerve, the posterior interosseous nerve too. So basically radial nerve and the branches it is giving in cubital fossa. It is giving a superficial branch and the posterior interosseous. Some reference even say that posterior interosseous nerve is also a content of cubital fossa. You can just write it as radial nerve and the superficial branch of radial nerve. So they both are coming here. These were the contents. Now why are we studying these contents, guys? That is what the clinical importance is. See, guys, in physiology we study how to measure the BP now. So if you're measuring the BP, you keep the stethoscope's diaphragm of the stethoscope in the cubital fossa. Where do you keep? The arm is in semiflexion, so you keep it medial to the tendon of biceps. Why? See here, guys, you just saw now. The brachial artery here is medial to the tendon of biceps, isn't it? This is the brachial artery. It is medial to the tendon of biceps, isn't it? So if this, if you keep the stethoscope lateral to it, will you hear the correct cough sounds correctly? No, you won't. So that is the importance of brachial artery. That's why we got to remember the relations in any part of the body, because we might mistake the medial aspect to the lateral aspect and we might get a wrong reading for that. And that was the importance, guys. I used to keep it in the lateral aspect, and I used to get scolded by one of our professors during my first year. So we have to keep it in the medial to the tendon of biceps over here. Basically, you can even palpate brachial artery there. We just studied about median cubital vein, guys. So why is it called median cubital? Because it is in the midline of the upper limb, basically. So see, this was the median cubital vein, isn't it? So this was the median cubital vein. Why is it important, guys? See here, the median cubital vein is giving a perforating branch. See, guys, just imagine this is the median cubital vein here. What is it's present superior to the cubital fossa, na? In the roof of cubital fossa. Below that, what is there? There is one interesting structure here, that is the bicipital aponeurosis. So there is a perforating branch which is given by the median cubital vein. What is perforating? It is going through the deep fascia, going to the tendon of biceps. So if it is going down, it will be well anchored there. So the vein doesn't move much when you are giving an injection, or you are doing phlebotomy to take out blood. So usually they tie a cuff here to reduce the venous return, and they take the blood or inject any fluid through the median cubital vein. That is more preferred in cases of people in whom the vein is visible. So usually they take it from this median cubital vein. So the blood collection is easy. It is anchored, so it doesn't move much, and like it is a superficial vein. It is very superficial. You can easily palpate it. So it is less pain to the patient itself and less chances of injury to any artery nearby. Okay, guys, this was the cubital fossa. If you have any doubts, please post it in the comment section. I'd be happy to answer you. Take care, guys. Bye.